In many cases, a patient's first interaction with a medical professional in a crisis happens when an ambulance arrives at your door. Today, we're talking to Paramedic William Schnepp, who works right out of Windham Hospital, and we're talking with him about all the kinds of calls that he's getting in the midst of the coronavirus. So welcome, William. Thank you so much for giving us some of your time. I know you're a busy guy.
Thank you for having me.
Our first question for you is, what has the last 2 months been like for you?
Oh, man. The last 2 months have been very busy. There's a lot of people at home who are complaining of fever or just generally feeling unwell. And so a lot of our job has been to sort through people who've had flu-like symptoms, from patients who might be suffering from coronavirus, and then, of course, all of the other medical problems that people have every day, like broken bones and appendicitis and car accidents. So it's been a mix of everything, but it's been very busy.
And I'm sure, just given the nature of the job, you do see a mix of a lot of different things. But how has your job actually changed since COVID?
I would say that my job has changed a lot in that we've all been very focused on being safer with our personal protective equipment. Now more than ever, we have to double check each other, sort of use a buddy system to make sure that we're wearing the proper gown, surgical mask, eye protection, so that when we plan ahead to meet patients, we know exactly what we'll need to be wearing. So it's been a much safer process, but it's definitely been more particular for all of us. We have to check each other every day.
And I'm sure it's taking a little bit more time too, just to make sure that you're protecting yourself. So by, the extra PPE that you're using, is that peer support? Is that what that's called?
It is supportive when we check each other. We want to make sure when we go into homes or into businesses that what we're wearing will protect us. We kind of do a quick double check to make sure that we're wearing everything that we need. We don't want someone going into a house when they're not protected. So we'll have someone stand outside of the house until they're ready. As far as peer support goes, we've had to really lean in on the doctors and nurses and firefighters and police officers and really help each other be prepared for the things that we're seeing in homes and for patients who are going to be calling with coronavirus.
And of course, it's so important that you're protected. But what about the patients you transport? How are they protected?
Patients who are transported with us immediately get a surgical mask, much like the one that I'm wearing today. That goes on first. We will wear protective equipment. Patients will wear their surgical mask. Every time the patient interacts with us, we'll have them wash their hands with maybe some hand sanitizer. And for the most part, we just keep them well covered.
All right. A lot of great information you're passing along to us. Thank you for everything that you're doing. It's not an easy job, but it's one that, we can't say thank you enough. You're right there on the front lines helping.
Happy to do it.
So, William Schnepp, you are a paramedic at Windham Hospital. Thank you again for your time this afternoon. Be safe.
Thank you.